This is Marissa, Amanda, Tristan, and Claudia filming our video on how to do a blood transfusion. The first thing the nurse will do is come into the room, wash her hands, introduce herself, and identify the patient.
Hi, I'm Amanda, and I'm going to be your nurse today. You know we're here because we're going to hang blood today because you're anemic, so we're going to infuse red blood cells. Can you show me your wristband and state your name and date of birth?
Marissa Marchand, 12/29/87.
Okay.
So the nurses explain the procedure to the patient. Next thing we will do is obtain consent.
Okay.
For
I have your consent forms here. Just going to see if I can get you to sign.
the patient has already been typed and crossed and has a blood band on her wrist.
Can you, this is just the consent saying you accept red blood cells. Thank you.
The second nurse has already left to go obtain the blood sample, double checking it and signing for it with the lab tech. She is back within 15 minutes after leaving.
So here is your blood. Do you want to?
Let's review our order.
Okay.
Here's our order.
See the order. Patient. Oh, wait, we need the chart. Let's verify this. You okay?
Here's her.
Oh, you're right.
Her blood band. Her type and screen. Her unit number is 123456 XYZ.
123456 XYZ. Correct.
So both nurses have obtained, ordered, and typed blood from the blood bank, double checking it both together, both nurses. The next thing that will happen, we will spike the blood bag, but before we do that, we will prime the line with normal saline.
My normal saline is primed.
Primed.
Okay, now I'm going to get my blood in here. I'm going to hook this up to my patient's PICC line with my alcohol swab. Do you have an alcohol swab?
Mm-hmm.
The patient already has IV access in place.
Yep. Cleaning it with my alcohol swab. Then I'm hooking her up to the blood.
Now before we start the blood, we will prime. We've already primed the line with saline, and we will start the infusion very slowly.
It's barely dripping. I want you to tell me if you have any reactions to this whatsoever. If you just don't feel good, headache, dizziness, diaphoretic, anything like that.
We'll drip the blood in very slowly for the first 5 minutes, retaking her vital signs within 2 minutes.
Starting her vital signs.
Vital signs are stable.
Excellent.
How are you feeling, ma'am? Fine. You feel okay? Mm-hmm.
Now we can go ahead and turn up the infusion slightly, so to infuse the entire bag of blood within 2 hours.
Let me check your vital signs again. Her vital signs are fine.
After 30 minutes, the chance of an acute, life-threatening blood reaction are almost over. Now if there's going to be a reaction, it's most likely just going to be a mild reaction. Any kind of life-threatening reaction, such as an acute hemolytic reaction or an anaphylactic reaction, would have already happened by now. We are looking for febrile reactions, any kind of mild allergic reactions, or circulatory overload.
Are you still feeling okay?
Yes.
We're
Check
going to
your
check
vital
vitals.
signs again.
We have been taking vitals every 15 minutes and documenting the patient's reaction per policy.
Vital signs are stable. Our unit is infused.
It's now been 2 hours. We can stop the transfusion.
Okay. We're also, I've seen that your PICC line is due for a dressing change. So I thought we could do that while we're here.
We're now going to move into the section of the video where we perform a PICC line dressing change. The old bandage will be removed in a clean fashion before moving to sterile dressing change.
Alright, I'm going to have you wear this mask, and while I'm working on this, if you could just try to avoid touching it or moving your arm. Alright.
While removing the bandage, the nurse is inspecting the insertion site for any redness, drainage, swelling, or any signs of infection. She also will make sure that the insertion point is where it was at the last documented area as stated on the tegaderm to ensure that the line has not migrated.
It's still at 1.
Okay. Writing on your notes. At 1.
Okay. Now if you
How
could
is
just be,
the skin?
my stat lock is off.
How is the skin around?
The skin is good.
No spreadness?
No redness, no is it tender at all around here?
No. Okay.
No pain at the site. Okay, now
We're switching gloves from clean
here's my trash.
to sterile.
This will now be sterile.
The nurse will set up her sterile field. Bio patch and stat lock. Chlorhexidine scrub.
I think 2 will be plenty. Ooh, that was close. Stay on. Alright, I'm going to crack my chlorhexidine and shake it. And I'm going to clean
Now we clean,
all around.
ensuring to get all parts of the catheter as well as the skin surrounding.
That one's dirty. Right. Get underneath this. Okay.
Unless you're going to let it dry.
And the nurse will apply the new bio patch after the stat lock. The stat lock ensures the line will not migrate out.
Okay, we are almost done. Now I'm going to apply the bio patch.
And that is done blue side up. And she will cover the entire area with a new tegaderm, ensuring to label the tegaderm with her initials, the length of which the PICC line is for the next dressing change, as well as the date and the time. In addition, as blood has been taken or sent through
Take this off now. I'm going
the caps, we will now perform cap change.
You have 2 lemons.
Before doing the cap change, we'll prime both caps to ensure patency.
Nurse, is it okay if I throw your trash away?
Yes. Okay.
She will clamp the lines before caps are removed to ensure no air enters the line.
Okay.
She will do a vigorous scrub of the caps for 30 seconds with an alcohol swab.
30 seconds. I have replaced my cap and I've flushed.
And everything is in good working order.
My next one. Oh, we already looked at it anyway. Could you please get me an alcohol prep?
Mm-hmm. Here's your alcohol prep.
Thank you. Okay.
Again, repeating the procedure.
It is clamped. The elbow's removed. 30-second scrub. And this one flushed with 10 mils. Now I will document it and chart it. And I will open my clamps back up.
No, you keep them closed.
Oh, we left it. Okay, never mind.
The blood, the previously administered blood will be disposed of in the biohazard. And
And my clamps are closed.
our dressing change trash will be put in the regular trash.
Okay.
And that is all.